This video will cover intrauterine contraception, more commonly known as the coil. There are two types of intrauterine contraception, one with a hormone and one without. Both are small T-shaped devices that are inserted inside your womb. They are very effective. For every 100 women who use the coil, less than one will become pregnant. They last for 3 to 10 years depending on which type you choose. If you do wish to become pregnant, the device can be removed and your fertility comes back straight away. Let's look more closely at the different types. Firstly, the intrauterine system, also known as the hormonal coil or Mirena, but there are other types available. It releases a small amount of hormone into your womb which thins the lining. This prevents an egg implanting. It also thickens the mucus in the neck of the womb which prevents sperm from reaching the egg. The intrauterine system takes 7 days to start working and lasts for 3 to 6 years depending on which type you choose. Bleeding can be irregular to begin with, but be reassured, for almost all women this does settle. Most women stop bleeding completely after 6 to 12 months. Some women will have lighter bleeds. This makes the intrauterine system a great option for women with heavier periods. Due to the low dose and local release of hormone, you are unlikely to get any hormonal side effects. Next is the intrauterine device, more commonly known as the copper coil. This works by releasing copper, which prevents sperm from reaching the egg and does not allow an egg to implant into the womb. The intrauterine device works immediately for contraception, and because of this we can also offer it as an emergency contraceptive in some cases. It lasts for 5 to 10 years depending on the device inserted. The intrauterine device can make your periods a bit heavier and more painful, so it may not be a good option if you already suffer with heavy painful periods. Women may experience spotting in between their periods for the first 6 months. This should settle. There are no hormones at all, so no hormonal side effects. This can be done in our clinics, and some GPs also offer this service. You will normally have an initial consultation to check your medical history and advise you on suitable timing for fitting. You will then be booked in for a procedure which will be performed by a trained healthcare professional. The procedure starts off a bit like a smear test, and then we pop a small clip onto the neck of the womb. We then measure the womb using a plastic instrument that's thinner than a pencil, and after that we can put the IUD or IUS in place. Everybody's different. It can be uncomfortable for some, and other women can find it more painful. The actual procedure only lasts for a few minutes, and most women tolerate it quite well. You can take some pain relief before or after the procedure. During the procedure, some women can feel faint. We will keep an eye on you throughout. Injury to the womb is very rare. There's a small risk of infection. Your individual risk of infection will be discussed with you on the day, and you'll be offered an STI screen. After the procedure, in some cases, the device can fall out. You may notice longer threads or an uncomfortable feeling if this happens. Pregnancy is very unlikely. If you do get pregnant, there's a risk that the pregnancy could be outside of the womb, known as an ectopic pregnancy. It's important to note that most women do not suffer any complications. You may have some cramps for about 2 days following the procedure, but you can carry on with normal daily activities. There's no need for a routine follow-up visit, but we do encourage you to call us at any time if you have any problems.